I wish I knew this earlier, but preparing your kitchen before surgery is the absolute secret to a painless recovery. Welcome to another explainer of FoodNourish, the explainer series of foodnourish.net, where we explore topics like health, food, supplements, and alternative approaches to health and wellness. I'm your host, and today we're breaking down a total survival guide for anyone facing oral, jaw, or bariatric surgery. Oh, and really quickly, just remember, this explainer is for informational purposes only, so it isn't medical advice. Let's jump right in. Look, if there's literally just one thing you take away from us today, it's this. You need to shop and prep right now while you're feeling 100% healthy. Seriously, picture it. The absolute last thing you're going to want to do after getting a tooth pulled or going through a major procedure is wander down a bright grocery store aisle. Your mouth is throbbing, you're totally exhausted, and you're probably still pretty groggy from anesthesia. Setting up your kitchen in advance gives you total peace of mind. You can literally just walk in, grab exactly what you need, and focus purely on healing. Okay, let's dive into this. A lot of folks use the terms liquid diet and pureed diet interchangeably, right? But confusing these two textures is exactly how people end up hurting themselves on day two. A liquid diet is anything you can sip or pour. Think broth, milk, or a really thin meal replacement shake. It has absolutely no shape. Now, on the other hand, a pureed or no-chew diet means the food actually has some body to it, but zero texture. We're talking yogurt, mashed potatoes, applesauce. You eat it with a spoon, but you do absolutely no chewing. Understanding this difference, it's your very first major step to a safe recovery.
Section 1, Pre-Surgery Shopping List.
Okay, so what do we need? First off, if you don't have a blender or an immersion blender, grab one. It's going to be your absolute best friend. You'll want to stock up on high-quality protein powder, Greek yogurt, cottage cheese, and plenty of broths or blendable soups. Grab some ripe bananas and avocados too, since they're super easy to mash. But listen, I really want to emphasize the baby food pouches and pre-made meal replacement drinks. Yes, baby food. Seriously, don't be afraid to raid the toddler aisle. When you're on day one and have zero energy to even press a button on a blender, an applesauce squeeze packet requires literally no prep. It is an absolute lifesaver.
Section 2, the first 24 hours. Your body basically has one primary job on that first day, and your job is to help it out. You absolutely must protect the blood clot at all costs. See, after a tooth extraction, your body forms a clot in the empty socket to shield the bone and the nerve underneath while the new tissue is growing. If you knock that clot loose, well, you get what's called dry socket. And trust me, you do not want this. It's a highly painful condition, and it completely stalls your whole healing process. So how exactly do we protect that clot? Well, it basically comes down to two things: temperature and pressure. You want to stick entirely to cool liquids or ultra-soft foods that you eat with a spoon. Smoothies, cooled down broth, pudding, these are going to be your go-tos. What you absolutely must not do is eat hot food or use a straw. Heat actually softens and dissolves the clot, which can restart your bleeding. And straws? The suction from a straw will literally pull that protective clot right out of the socket. So ditch the straws entirely and let your hot soup cool down to lukewarm. Now, we're going to talk about the exact nutrient you need to rebuild your tissue in just a second. But first, a quick break. If you're looking to stock up on supplements or wellness products for your recovery, head over to foodnourish.net/deals. We've gathered some amazing exclusive discounts from top-tier brands like iCurb, Source Naturals, Alchemy Elements, and Bioptimizers. It's a really great way to support your health journey and save some money while you're at it. You can find the direct link right down in the description. Section 3, Protein to Rebuild Tissue. Welcome back. So the dilemma is pretty obvious, right? Most of your classic high-protein foods, like steak, chicken breast, or almonds, demand exactly the kind of heavy chewing that you absolutely cannot do right now. So you have to get incredibly smart about stacking soft protein. If you break your protein intake into 20 to 30 gram blocks throughout the day, you're giving your body a constant supply of the building blocks it needs to speed up recovery and keep your energy stable. And the best part? You're doing it all without making your jaw do any work.
Now, what's really interesting about this slide is the hierarchy of high-protein, no-chew foods. When you break it down, look at how easy it actually is to hit those blocks. Just a single scoop of protein powder mixed into whole milk gets you nearly 30 grams. A cup of smooth Greek yogurt, that gives you 18 grams. Half a cup of cottage cheese offers 13 grams, and soft scrambled eggs will give you about 12. You can even mix in refried beans or silken tofu if you want some variety. By just combining a few of these options across your day, you easily hit your protein goals to rebuild that tissue, all without a single chew.
Section 4, clean and healing snacks. You know, when you're recovering, you might not have much of an appetite at all. That's totally normal, thanks to the soreness and the pain medication. But here's the thing. Losing weight during recovery signals to your body that it's short on calories, and that actually stalls the healing process. So instead of trying to force down 3 big, heavy meals, aim for 5 to 6 very small meals or snacks. And here's a quick pro tip for you. To pack in calories without adding bulky volume, use whole milk instead of water in your shakes. Or you can stir a tablespoon of smooth nut butter or olive oil right into your smoothies or soups. Let's take a look at how your diet should naturally progress over that first week. Day 1 is strict. We're talking cool liquids and ultra-soft, smooth textures only. By days 2 and 3, you can usually graduate to soft, no-chew items. Think slow-cooked scrambled eggs or perfectly smooth mashed avocado. Then, by days 4 through 7, as the swelling starts to go down, you can move into expanded soft foods, things like hearty blended vegetable soups or mashed sweet potatoes with a little butter. The idea here is that you're gradually adding texture back at a pace your mouth can comfortably handle. And to prevent you from getting completely sick of plain yogurt by Wednesday, here are a few brilliant no-chew recipes. Try a smooth banana oatmeal. Just thin it out with extra milk so it's nice and loose. Scramble your eggs on low heat with a splash of milk so they stay incredibly soft, not rubbery at all. You can boil sweet potatoes until they practically fall apart and mash them up with butter. You could even take a hearty chicken and vegetable soup and run an immersion blender through it until it's spoonably smooth. Or hey, simply blend avocado with cottage cheese for a really savory, high-protein snack. These give you incredible fork-soft variety. Section 5. Foods you must avoid.
All right, you absolutely must avoid hard and crunchy foods like chips and crusty bread. They can literally scrape the surgical site and invite an infection. Sticky and chewy foods like caramel or gum will actively tug at your stitches. Spicy foods and acidic things like citrus or tomato sauce will severely sting and inflame the raw tissue. Carbonation really disturbs the surgical site, and alcohol reacts terribly with pain meds. And please, beware of tiny seeds like the ones in strawberries or chia. Those little guys can easily get trapped deep inside the healing socket, and that is a total nightmare.
This is probably the #1 question everyone has. When can I finally chew a normal meal again? Well, the timeline heavily depends on your specific procedure. For basic wisdom teeth or tooth extractions, most people return to a normal diet in about 7 to 10 days. If you're going through a bariatric puree phase, it's roughly 4 weeks. And for major jaw surgery, you're looking at up to 6 weeks of no chewing to really let the bone properly heal. But remember, always listen to your surgeon's specific timeline above all else.
So, the crucial point is this. Your post-surgery recovery is largely within your control, provided you prepare for it right now while you're still healthy. By stocking up on the right gear and strategically stacking your protein, you're setting yourself up to rebuild tissue, keep the site clean, and heal so much faster. Check the episode description for all resources mentioned. Subscribe to the channel, like the video to help us grow our channel and continue delivering deep dives in health matters, and to subscribe to our channel to never miss another video. Before you go, ask yourself, will you leave your comfort and recovery up to chance, or will you take control of your healing today? Thanks for hanging out with us, and here's to a speedy recovery.